I know I won't be here next year, and it kills me knowing that a sunbed's done that to me.
Even one session on a sunbed can be deadly. You begin the journey with melanoma with a little mole on your skin, never for one moment thinking that this will spread to your liver, to your lungs, to your brain.
I had it when I was pregnant with my son. He has a high risk of contracting melanoma. I'm more worried for him, of him not having a mum in the future.
They just told me it'd gone too far now, and you've got about 6 to 8 months to live. And then you just start thinking you've got to leave all your family, your brother, and like, you're leaving everyone behind you. And I know I won't be here next year, and it kills me knowing that a sunbed's done that to me. And I just want people to know how bad it is.
Terry, my husband and I decided to get married, and we decided to go and use some sunbeds to get a little bit of colour for our photographs, so that, you know, to make us look a little bit better. Terry only used the sunbed 4 times, and 6 years later Terry was diagnosed with malignant melanoma, which cost him his life at 48.
I was told it could possibly be melanoma, and I was to have a mole removal. I went back to have my mole removal, was told it was malignant melanoma, and realised it was more serious than I firstly imagined.
At first I just thought it was nothing, but obviously it kept coming back. They kept telling me how bad it was, but I just thought, didn't think it was too bad, skin cancer, but it's the worst one it gives you, malignant melanoma, and it's untreatable once it gets to my stage.
It's like the mafia. Once you're in, you can't get out. You're always looking over your shoulder and living in fear of the disease progressing. And even though I was clear for 13 years and the anxiety levels had dropped, it suddenly came back again after that time.
They've cut my thigh open 2 times. They've took my lymph nodes out my groin, which was a pretty big operation, and now it's come back in both lungs. So I had some in my neck, in my arms. It's all over my body, really.
Sunbeds mimic the effects of the midday sun. They are very, very strong. We are covered from head to foot in skin. Our soles of our feet, our hands, our lips, our skin is our biggest organ. So for me, it doesn't make sense to burn it.
You look at a packet of cigs, you've got a picture image, so you know what that's going to do to you. You go in a sunbed, you've got a nice little cut out sign, and you look at it and you think, what you know what I mean? It doesn't even sink into your head what it can do. The malignant melanoma, stage 4, there's no cure for it. Without a doubt, you're dying if you get this.
Malignant melanoma is just as bad as all the other big cancers that we hear so much about: breast cancer, lung cancer, bowel cancer, if it gets away.
And when they give me that news, for 2 days, 3 days, I couldn't concentrate on a thing. I'd look at the telly, I'd try watching it, and nothing would sink in. I can't even explain how bad getting that news is. It's terrible.
Some melanomas are removed and patients are cured by the surgery. But if that is not possible, if the tumour has already spread or spreads after surgery, then melanoma will kill you.
It's just not worth your life, really, because, you know, Terry used it, and, you know, he wasn't a sunbed worshipper, you know. That's how devastating it is, really.
Having melanoma has scared me. I had melanoma whilst I was carrying my son. He has a high risk of contracting it. We cover ourselves up with sun cream every day. We protect our skin. The fact that Oliver may not have a mum in the future, that's terrifying.
Think of your family, because it's not just you it affects everyone, all your friends, friends, everyone, all your family. You've got to leave all them behind. So I think it's quite selfish for you to go on a sunbed and think of your time.